On Friday of last week, there was a public hearing in Florida regarding a rule being proposed by the state's Agency for Healthcare Administration that would restrict Medicaid funding from transgender drugs and procedures. Why is that important? Should other states do likewise? Joining me now to talk about it and talk about the rule, as well as Friday's hearing, is Aaron DiPietro. He's the Legislative Affairs Director at the Florida Family Policy Council, and he's the Political Director for Florida Family Action. Aaron, welcome to Washington Watch.
Thank you, Joseph, for having me. It's a pleasure to be here.
Well, we're glad to have you. Before we get into the details of the hearing, be specific with us if you can. What is being attempted there in Florida?
Absolutely. That's a great question. I can read the rule change that's being recommended right now. It's very short and simple. It's basically saying that Florida Medicaid does not cover the following services for the treatment of gender dysphoria. Number one, puberty blockers. Number two, hormones and hormone antagonists. Number three, sex reassignment surgeries. And number four, any other procedure that alter primary or secondary sexual characteristics. In a nutshell, that's pretty much what the rule change that's being recommended is stating.
Now, a lot of us around the country have watched you and your governor with great admiration as we see what's happening there in Florida. Is this something that came from the governor's office, from Governor DeSantis's office, or is this something that came from the agency?
So this is something that came from the Surgeon General, Joseph Ladapo, here in the state of Florida. And I would have no doubt, though, that the governor had a strong say in that and pushing this, very common sense policy that, Florida taxpayer dollars should not be paying for these procedures based on the lack of evidence. And in many cases, the clear harmful evidences of these type of treatments and procedures.
Now, Aaron, we're very familiar with debates over the use of taxpayer funds for abortion. Is this essentially the same argument that this is something that taxpayers should not be forced to pay for because of conscience issues, or is it science issues, or is it a combination of those?
I think it's a combination of all of those, and even more so. Obviously, there's the conscience factor that we should not be paying for things that clearly violate the conscience rights of many Floridians. But I think even beyond that, the scientific data is so much not on the side of the whole gender transition and reassignment procedures movement. And actually, the Department of Health, or the department, ACA department, the Agency for Healthcare Administration, which was the one that held the hearing last Friday, actually did an extremely detailed report, and actually were very conservative in their estimations of many of the problems. But even at that, they went through a very detailed medical and scientific analysis of the problems with gender reassignment procedures, treatments, hormones, and other services on that nature, and putting that out there to say, the evidence is not on the side of this. There's a lot of inconclusive evidence. In fact, there's a lot of potential harms, and we need a lot more studies over the long term before we're going to be throwing taxpayer money at this issue. So they went into a very detailed scientific analysis of this types of procedures as well.
Now, this rule would restrict the use of Medicaid funds for those procedures. How much money is currently being spent on that, if any, or is this a preemptive move?
I think this is somewhat of a preemptive move. I think there's been maybe select cases that have been occurring, but I think both the State Department, the ACA department, and the DeSantis administration as a whole is seeing many of the procedures and seeing kind of some of the trends that we're seeing nationally, both in states like California, New York, and really trying to take a preemptive measure to say, no, we're not going to allow this to go any further here in the state of Florida. We need to be able to be a wise steward of taxpayer funds and make sure that we're not encouraging and pushing state monies for these very harmful procedures.
It's really reasonable, of course, to assume that that would become part of the objective, because that's how the left works on these things. Once they decide that there's a right for you to do something, they then conclude there's a right for you to have your neighbor pay for it. And we've seen many examples of this. But how many states currently fund this? Is this a move, a rule, or a law that other states should also be considering?
Oh, absolutely. I think it's something that the other states should be considering. The ACA department's health report actually went into some of the other states. There are quite a few states in the nation that don't have policies one way or the other. It kind of shows that we're really at the genesis of the push to get Medicaid dollars in different states. But the ACA report does cover roughly, I would say probably about maybe about 20 or so states currently, 20 to 25 states. I don't know the exact numbers. I'm looking at the maps right in front of me right here, have explicit provisions in terms of providing state Medicaid funding for these types of treatments. Now, there are distinctions in different state laws between, funding that's allowed for puberty blockers, and then there are separate restrictions on something like a sex reassignment surgery. So it varies from state to state. Some states allow all of the above. Some states restrict certain ones and allow others. And then a few states, probably only around, I would say, even probably less than 10 states currently have pretty strict restrictions on these types of procedures, which I think Florida is helping to step ahead to kind of be one of the front runners and saying, we need to start actually putting this down as a serious policy in state law right now.
We're talking to Aaron DiPietro. He's the Legislative Affairs Director at the Florida Family Policy Council. Aaron, at this hearing, you've talked about the evidence that was presented, the scientific evidence that this is not great science. This is not necessarily good for the kids. There's lots of evidence that this is not actually helpful to people. What did the other side say? I assume they presented a case as well. What were their arguments for why public dollars should be made available for this?
So I think part of it was, there was two factors. One was the appeal to all the different organizations, whether it's the APA or the American Medical Association, and these other organizations that have been, quote unquote, put out guidelines or recommendations encouraging these types of procedures. The problem is, as we know, Joseph, many of these organizations have become very compromised by leftist activists and have kind of ceased to become really arbiters of medical, doctrine, and have become more pushers of the leftist agenda. Another point that was mentioned, though, I believe it actually by one of the experts that the state had brought in to kind of help, oversee and guide some of the testimony given, was Dr. Quentin Van Meter of the American College of Pediatrics. And he actually pointed out that in many of the recommendations you see out there from some of these, supposedly reputable medical groups, they're actually putting out something that are considered to be guidelines or recommendations. That's something completely different in the field of medicine, of what would be called the standard of care. Standards of care are rigorous, tested and, measured points of reference for medical treatment and procedures. Those many times take decades of testing and experimentation to be able to get those down to a rigorous science. We have none of those on the field from any of these organizations, standards of cares. All they have been providing are guidelines. And as Dr. Van Meter stated in the testimony, guidelines are simply one physician's opinion. That's pretty much all that a guideline is, compared to a standard of care, which is a tested, proven procedure and recommendations for guidelines of care over a long haul versus someone's writing a paper and giving their opinion.
Aaron DiPietro, we really appreciate your time. This is an important story, and in so many ways, you and the state of Florida have been leading for the rest of the country. We hope this is another example of that. Thank you for your diligence, and thanks for taking some time to share with us today.
Thank you so much, Joseph. It's a pleasure to be with you.